Come on.
Okay. So are you ready?
Yes, ma'am.
For task. Hmm, Okay, started your 2 minutes time.
Okay. Next page.
One more page, okay. After this.
Okay. Okay, ma'am. Next. Okay, ma'am.
Last 40 seconds. Okay, started, dear.
Hello, I'm Dr. Smita. One of the doctors in the clinic today. Can I confirm your name and age, please?
Yeah, I'm Gail. I'm 32-year-old.
How may I address you?
Gail is fine.
All right. Gail, I could see from the GP letter that you are 8 weeks pregnant, and this is your second pregnancy, and you have a medical condition called Crohn's, and you're here for your booking. Am I right?
Yeah, doctor.
Gail, do you have any concerns and expectation after today's consultation?
Yeah, I just wanted because I'm taking this tablet in Fiximap, so I just worried about this baby getting baby affected because of this tablet. And how will be my baby? How will be my pregnancy? These are my concerns.
Sure, Gail. We'll be addressing all your concerns shortly. Before that, is it okay if I ask you a few questions to know more about you, so that we can discuss further? And at the end, I will be giving you the written information as well, leaflet to read about, and I can fix and follow up appointment. Will that be fine?
Okay.
All right. Moving forward, can you tell me more about your medical condition in detail?
Yeah, doctor, I was since last 8 years I'm having this condition, and it was on and off. I was getting this diarrhea, pain, blood. Uh, so it was giving me a lots of trouble. But since few years, I have started this on this infliximab, and my condition is improved now as compared to the previous medication, and I'm regularly on follow up.
All right. May I know, are you visiting a specialist regularly? And when was the last
Yes.
visit?
Yeah, it was 6 months back. I do visit him regularly.
Okay. And has your medication been reviewed by him? And is he aware that you are planning for a pregnancy?
Not means actually it was planned pregnancy. I told him that I'm planning a pregnancy.
All right. And may I know, recently, did you have any admissions?
No,
Okay.
my
Currently, do you have
condition
any
is
symptom?
my condition is better off since last 6 months.
Okay. Currently, do you have any symptoms like any bowel problems or blood in the stools, loose stools?
No, my condition is very stable since last 6 months.
All right. And are you taking any other supplements other than what you mentioned?
I'm on folic acid as per the GP who has already started, and another medication is prednisolone and vitamin D.
All right. And can you tell me about your pregnancy in detail?
Yes, doctor, this is my second pregnancy. I'm 8 weeks into current pregnancy. My periods were also regular. This is a
Okay.
planned pregnancy, and I am looking forward to it.
All right. Good to know. And currently, do you have any symptoms like pain, bleeding, spotting?
No,
Okay. Any nausea or any sickness or vomiting?
no,
Okay. And when was the last menstrual period?
8 weeks back.
All right. And do you have any other medical concerns like diabetes, hypertension, or thyroid issues?
No.
Okay. Can you tell me about your previous pregnancy?
Yeah, doctor, actually, although it was also planned pregnancy, I was already diagnosed as a case of Crohn's that time also, and pretty well controlled. But my baby didn't grow the way it should have been. And at 36 weeks of gestation, then they decided to go ahead with the cesarean section. My baby was too small. He was just 1.8 kg. He stayed in an ICU for 3 4 days, and then only we could able to take him to the nursery and then to the home. So it was little um, discomforting feeling for me that this time also again my baby will be the same. So after that the baby is fine.
Okay, I can acknowledge your concern. It must be very stressful for you during that time. Please do not worry. We are here to help and support you throughout this pregnancy. And may I know how was your recovery after delivery? And
Yeah,
what was the mode of delivery?
I
I could
was,
see it.
I delivered by cesarean section. I told you that. The mode of delivery basically cesarean section. After 2 days, I do have had a bout of tummy pain and that bloating and then distension, and then they kept me just NBM for a day or 2 days, and then they mentioned that I had plenty of adhesions in my tummy. Scar tissue is very very bad, so I just wanted to check that also. Could it be there again?
Gail, I'll be addressing that shortly. Is it okay if I go through your notes with your permission, if
Oh
you
yeah,
had?
yeah, yeah.
All right. And do you have any family history of concern or similar condition running in the family?
No,
Okay. Any surgeries other than cesarean section?
no,
Okay. Do you have any allergy?
no.
Okay. Your blood group?
I think A positive. Do you
Okay.
do my since you mentioned about family, do my baby also have chances of getting this?
Gail, I must tell you that this condition does run in families, but there is no proper inheritance patterns for this. But there is a small chance if any of the parents are affected, there is 5 to 20% chance that baby might get affected. But there is no proper inheritance to talk about. Are you
Okay.
able to follow me?
Mm.
Moving forward, may I know any reservations for blood do you have?
No,
Okay, and of late have you felt low, depressed?
no.
And what do you do for living and how is the support around you?
Um, I'm a housemaker.
Okay. And a few personal questions like do you smoke, take alcohol,
No,
take any recreational drugs?
no,
All right. Gail, do you like to add anything else?
no.
Okay. Thank you for sharing the information. Gail, I would like to take an examination as well in the presence of chaperone with your concern. Will that be fine?
Oh yeah.
All right. Thank you for allowing me. And moving forward, coming to your concern and about the pregnancy and having the medical condition called Crohn's. May I know what do you know about this?
Yeah, I know everything about Crohn's doctor now. I'm having this condition since long.
All right. So let me explain to you. It having this condition, it does have some implication on both mother and the baby. But I can reassure you that when the woman conceives when the disease is stable, and in that case can have a successful pregnancy and have a healthy baby with the proper care and support. right? And I could see that you're not having symptoms for past 6 months. It's a good sign. And the effect of the pregnancy on the condition could be that when the disease is stable, there is 30% chance that there could be possibility of a relapse during the pregnancy. And most commonly, the relapses are seen after delivery as well. So we'll be taking care of you. And the effect of the condition on the pregnancy is that, as I said, when the disease is not, when the disease is very active, then in that case, there is a possibility increased risk of miscarriage could be there. And there is a possibility that baby can be born before 37 weeks and baby might be small for the weight as well. And there can be problems like having a nutrition deficiencies in the mother, increased risk of cesarean section could be there. And there is increased risk of clots also exist. Are you able to follow me?
Yeah.
And also, I must tell you that I could see you're on few medication. It does has some effects like with the steroids. There is a 0.3% that baby might have a small cleft in the lips. There is increased of having a BP and blood sugar as well. So we'll be taking utmost care. I will be following you. Shall I move forward and explain to you your pregnancy plan care?
Yes, I would like to know.
Yeah, sure. Gail, your care will be under consultant-led unit, and you will be cared by a multidisciplinary team involving my consultant, and also we'll be involving the gastroenterologist as well, and the specialist midwife and the IBD specialist nurse will be involved, and as well as the fetal medicine specialist, the sleep doctor, baby doctor will be involved in your care, and the dietitian as well. So you might be expected to come for a frequent visits, and I could see you're on folic acid and vitamin D supplements. You have to continue that, and folic acid has to be 5 milligram has to be taken to 12 weeks. And considering have previous baby being small, we would consider to start an aspirin uh, from 12 weeks onwards. All right, you're able to follow me till now?
Yeah, I am able to follow
Yeah.
you. Yes.
Yes. So we'll be also assessing you for the need for blood thinners as well. And at every visit, your some any flare symptoms will be assessed, like any abdominal pain or loose stools or any blood in the stools. In that case, if you find any symptoms, you have to report to us immediately. We'll be providing you 24/7 contact number as well. All right, and we'll assess you your blood. We will every visit we'll assess your blood pressure and urine. The proteins will be checked, and we'll review your medications as well with your specialist, the infliximab and the steroids mainly. Um, because the infliximab, what you are taking, we consider it to stop by 32 weeks, but with the specialist input. And the steroids, the dose and the frequency also will be reviewed by your specialist. Are you able to follow me?
Yes.
And also your we'll be offering currently we'll be offering you an blood test and the dating scan, and we'll book your down screening test as well. At 18 to 20 weeks, you'll be offered an anomaly scan with a fetal medicine specialist, considering you being on steroids, as well as your baby growth also will be monitored. And you will be offered a blood sugar test between 24 and 20, between 24 to 28 weeks. All right.
Okay. And
And am
doctor,
I clear so far?
how I'm going to get delivered?
Yes, coming to that, so your delivery plan will be made involving a multidisciplinary team. Even you will be involved in that, and we'll take an anesthetic, the sleep doctor review by 36 weeks, and we will consider a trial of vaginal delivery, assessing that when if the disease is not active and when there is no scarring, if we in the vagina or the area around the vagina is there, we could give a trial of labor, but there will be a low threshold for cesarean section. In if there is a need for cesarean section, in that case we might need to involve by the our senior consultant as well as the surgeon as well, considering that possibility of additions could be there. Are you with me?
Okay. Okay.
And
And this
also
infliximab, can I stop this medication, doctor?
the medications what you're on, we recommend you to continue until it's reviewed by the specialist. Generally these are considered the infliximab, though it's not licensed in pregnancy but it's considered safe. So we recommend you to continue it until it is reviewed. Okay.
Okay. Yeah.
And if you're on steroids, then you will be given stress dose of steroids during your delivery through your arm. And after delivery, your baby will be cared by your baby doctor. And also, Your medications also will be reviewed by your specialist, and you will be encouraged to breastfeed the baby. We'll assess you for blood thinners as well, and we'll give you a safe contraceptive advice, avoiding any estrogen containing pills. All right. And I know I've given you a lot of information. I'll give you the written information on these, what we have discussed. Do you have any questions for me?
No, thank you.
All right, I'll document our discussion. I'll fix your blood investigations, as well as I will fix your dating scan as well. Would that be fine?
Yeah,
I'll
thank
write
you.
back to your GP. I'll fix an appointment with my consultant as well. Thank you for your time.
Okay. Okay, your own feedback.
Hmm. I was rushing like I wanted to complete it. No.
Time management.
Yes. So I
Biggest
think that
drawback
is I
is
was never
time management. Biggest drawback is time management. Because you asked me the same history what has been given here.
repeatedly. Okay. Yes, ma'am.
Okay.
Yes, ma'am.
And too many times paraphrasing with the patient, too many times saying okay, we are there to help you out, or
Okay.
so this is again also a times you have to say once twice, that's it. Not
Okay, ma'am.
every time if the patient is saying, because if you are going to say all those sentences every time, your time is not going to be on your side. Hmm?
Okay, ma'am.
So
Okay,
ensure
ma'am.
that you will manage your time, and this information has been given. It has been mentioned that I am symptom free since last 6 months.
Yeah.
Acknowledge whatever information has been given. Write it down on your paper and pen with the help of your pencil. Do not ask me the repeated history, okay? And that's the
Okay,
reason
ma'am.
you weren't able to complete well within time. You took almost 14 minutes plus time. Hmm?
Okay.
Okay.
Okay, ma'am.
Anybody wants to
I'll be
comment
sure.
on her performance?
Ma'am, it is a very excellent performance, ma'am. Only few points, ma'am. It is
Mhm.
the VT risk assessment and
She
low
mentioned something
molecular.
like she mentioned something like that.
Okay, ma'am.
Blood
Then
clot, she mentioned
yeah,
blood clot, but she has not mentioned that VT risk assessment will be done.
yes, ma'am.
Okay, we will take it that. Okay, then
And
another point.
Okay, ma'am.
uh, and the mother treated with infliximab, baby should be avoided live
Yeah, with the
vaccine
live app.
for 6 months of
Yes.
time. That's all,
Yeah.
ma'am. Otherwise, it's a very perfect.
Yeah, time management is not the perfect thing. It should
Yeah,
have been the best if you would have squeezed this within 10 minutes. Okay,
yes, ma'am.
most of the information you had
Okay, ma'am.
given, but the time management was the problem. Okay, so
Okay,
if you
ma'am.
see my answer key, situational awareness, GP referral, congratulations because it's a planned pregnancy. See, I am just saying this because you never know, lay might be there. Worry
Okay.
about medication, pregnancy, baby, too many questions, okay? Too many questions. So you addressed very well, okay? Very well, one by one. Acknowledge information shared by GP. So it is 8 weeks on infliximab, folic acid, low dose. Here only you can say that I will be anywhere, means you can say then and
Okay.
there also, you can say in the latter of also, but you mentioned that you will be increasing the dose of folic acid 5 mg, okay? Acknowledge the information given by GP. So 8 weeks from my last period, I mentioned that it is my regular period, last period.
Regular
Again, you
cycle.
asked the same history, okay? Pre-pregnancy counseling, basically it was all control, but you can ask whether means you
Sure.
you asked me in detail about Crohn's history. So here also you can ask, have you taken pre-pregnancy counseling before getting pregnant? So yes, no, it's okay. Then Crohn's disease history was well in detail. Open question, since how long? Acknowledge her disease. It is under control. Any bowel symptoms as of now? No. Any surgery for this condition? Because Crohn's disease is getting treated with surgery also. Last
Yes, ma'am.
follow up, you may access the notes with her permission. Very lately you realized and you access those notes. If it is unplanned, then only advise contraception. If it is planned, no need. Okay. Menstrual history, basically LMP is corresponding, so no need to go in detail. Access details, outcome, baby, recovery. Okay, so these details also you need to know. You access. Now here onward, you just rush your history very quick. because those two histories are very lengthy. So any other medical condition, any surgery you had asked in the beginning only, because associated with Crohn's only you asked. So no need to ask. Allergy, if any allergy, acknowledge and document. Here I have not mentioned. Smoking, acknowledge. No alcohol, smoking and alcohol, it was not acknowledged, it was alcohol. BMI, it is normal. Support, thank you. Okay. Check background knowledge about her pregnancy, her views, her and Crohn's disease. If I'm having a Crohn's disease from the last 7 8 years, or I will
Mm.
not need any information for Crohn's disease. I will be knowing. Okay, so you
Okay.
can skip that information, but ask. Okay, ask patient whether she
Mm.
is really keen to
No, whether no.
know. Yeah. So you asked me. I am happy for that. Here there are three risk factors here. One is previous SGA baby, cesarean section, and Crohn's. So these are three risk factor in her case, and that's the reason her pregnancy will be high risk. Consultant booking, gastroenterologist, nurse specialist, midwife, and nutritionist. Nutritionist will be a part of her team because Crohn's disease is associated with malabsorption.
Yes. Okay.
Implication you mentioned, being pregnant may reduce the likelihood of, means how this P and C is pregnancy on Crohn's and Crohn's on pregnancy. So pregnancy on Crohn's, if it is under remission, the very likely the disease will be stable, will not recur, and post delivery, yes, there are chances of flare up. Okay,
Okay.
post delivery. Uh, in her case, less likely it will recur, or the control will be very good. However, Crohn's on pregnancy, if the disease is controlled, there is a very good outcome. You should not worry about it. Regarding drugs, we will discuss that. But if the disease is not controlled, then yes, there we have seen certain miscarriages, growth restrictions in the baby, and nutritional deficiencies. Okay, nutritional deficiencies. These are the risks which we have discussed, which we have seen. The effect of drugs. Now here basically we need to discuss effect of drugs. Steroid, we all know there are only two three options when it comes to steroid: anomalies, sugar, and steroid rescue. Say in the
Mm.
one line. Okay, so we will be screened for the abnormalities in the baby. Check your sugars at 24 to 26 weeks, and steroid rescue dose will be given when you will be once you will be in labor. Regarding infliximab, you mentioned very nicely that it is not licensed, but no evidence of teratogenicity on baby or development. They should be ideally avoided in third trimester. Mostly they will be safe up to 28 weeks, but after third trimester they should be avoided to minimize exposure to the baby. And yes, we need to avoid this live vaccines. Okay,
Okay.
these drugs and medicines do not seem to be associated with major adverse effects when used during pregnancy. But in first exposed to these drugs in utero may be at risk of adverse reactions to live vaccines. Therefore, live attenuated vaccines should not be offered to these babies up till the age of 6 years. This is very important patient safety point. Apart from that, she can very safely continue this medication, although it's a unlicensed medications. Mm, Also, during breastfeeding also we will have to take a consultation from gastroenterologist. There is a chance that it might get transferred to the baby. SGA risk, since there is a baby is at risk of small for gestational age or a small baby, uh, we have to do a serial growth monitoring, and
Okay.
stopping this medication will cause flare up, so stopping is not recommended. We need to say stopping is not basically we can't do that. It will be all gastroenterologist and consultant who will be doing it. So that is not been done. So effect of drug was my major concern, so take at least 1 minute to explain me that. Hmm?
Okay.
Simple. This is, see, the pregnancy per se is not going to be that risky that you are going to say so many risks here. Few risks are there. Apart from that, no much risk here. So here I am more worried about my that infliximab on my baby. So give me that option. Cesarean section, adhesions,
Okay.
whether there will be adhesions during the C section, because last time there was plenty of adhesions. Yes, there might be. The adhesions will not go away. Okay, so now antenatal care plan will be Extra care to minimize complication associated with this folic acid 5 milligram. Apart from routine antenatal care, one need early USG for the fetal heart, detailed ultrasonography from fetal medicine experts as and when needed, because she was at risk of small forest baby. Small, the baby was small last time, and now she's also on steroid. If blood clot risk, then low molecular weight heparin will be considered according to body weight. At each visit, she will be screened for blood pressure, urine protein, and baby's growth will be charted. When need arises, she will be start on low molecular heparin. Since she's
She
on
will be score
steroid,
3.
yeah, no, you do not need to say. That is a
Okay.
detailed knowledge. Here, what mistake we
Mm.
are doing actually, we are just going to say depending upon the
Everyone.
risk.
Okay, ma'am.
Okay. That naming is important. Depending upon
Okay,
the
ma'am.
risk, VT risk assessment will be done, and depending upon the risk, she will be offered low molecular weight heparin, okay, blood thinner. That's it. And sugars 24 to 26 weeks, serial growth scan 24 to 26 weeks till delivery. Okay, till delivery. If normal, nothing to worry. If abnormal, then in that case, we may have to again consider an option of early delivery. That is very important point, because previously there was SGA. This time also there is a chance that she might have the SGA. So if the scans are abnormal, then she will be offered early delivery this time also. Mode of delivery will be discussed with the help of team, including her anesthetist, nearing term. So she will be discussed both the options, so plant cesarean section and VBAC. In her case, plant cesarean section will be, means, see, more VBAC is an option where she can have a successful, means there is a good chance that she might deliver vaginally. But if there are any concerns with the baby's growth, then a plant
Well-being.
cesarean section will be considered electively to avoid risk of adhesions, risk of injury, and in the presence of seniors. Okay, in the presence
Okay.
of seniors. So that is, both the options will be considered at that time. So here we cannot counsel her regarding VBAC option only. We need to be open here. We will be discussing both the options as and when needed. If no concern, then VBAC will also be an option. We will aim, in that case, we will aim for vaginal birth, discuss pain relief, continuous fetal heart rate monitoring, steroid rescue in both the options, VBAC or cesarean section. Once the baby will be delivered, baby will be assessed by the neonatologist, and slightly the baby is having more risk. Inheritance and all those things we do not want to listen. We just want to listen whether there is an increased risk or less risk. Yes, since the Crohn's disease is having a multiple, means what we can say, etiological factors, what we can say there are
Risk factor.
various causes for Crohn's disease. Genetic is one of those. Yes, there is a small possibility that the baby might have this condition.
Okay.
Inheritance and all those things we need not be saying here, because it's not inherited, genetically inherited. But the multifactorial disease, one of the cause might be genetic. So yes, baby might be having. Now, baby to be assessed by neonatologist slightly at risk of having Crohn's disease. Now referral to the gastroenterology for drug review. Mostly she will be continued, and this drug will be stopped after second trimester. Nutritionist will be a part of this team, because she is at risk of deficiency. Continue her vitamin D support group, right back to the GP, and document her care. Okay. Crohn's and colitis, something like that, is a support group. I have not
Okay.
mentioned this time. Crohn's and colitis UK. Okay. Now coming to the domain wise scoring, here only two history is important: the disease history and her current pregnancy history. Her views, expectations. Remember this. Okay.
Yes.
So relevant history, diagnosis was made, duration of medication, disease active or not. Which was, so interpreting GP letter, most of the history is completed. Physician managing Crohn's disease, medication prior to pregnancy and during pregnancy, any folic acid dose, past obstetric history, complications antenatally, mode of delivery, if vaginal, any associated perineal or vaginal scarring. Review of medical investigations and record. You mentioned that also. Communication with patient and families is very high here. Means very good. Means so many points are here. Sign self and introduce self and role. Signpost antenatal care in timing of investigation at various steps. Communicates information at reasonable pace, ensuring that patient understand, encourage questions, and provides answer. Impact of pregnancy on Crohn's disease in up to 72%. What it is? 75% of those who have active disease at the beginning of pregnancy, disease becomes quiescent, remission more likely in the puerperium. Discuss impact of Crohn's disease on pregnancy. Inactive disease has minimal impact on pregnancy, including delivery. Active disease may be associated with miscarriage, preterm labor, small for gestational age, and increased cesarean rate. Importance of continuing with medication throughout pregnancy. Discuss prenatal screening, monitoring of the fetus, and timing of the mode of the prenatal screening. Basically, yeah, we can screen the babies. Depends on mode of the delivery, previous baby and state of perineum and vagina. If no scarring, then vaginal delivery anticipated. Communication with colleague, gastroenterologist, fetal medicine, anesthesia review, feedback to GP, community midwife, nutritionist. Okay, here they had not mentioned the
Okay.
nutritionist, but nutritionist will be a part of this Crohn's disease management. Patient safety, a certain drug allergy, safety of drug, that is infliximab, which need to be continue with medication, need to continue with medication. This is important to continue. Okay, so pros and cons of both the options. Not licensed, but still we can continue this medication. Till how long we can continue, and what are the precautions we need to take with infliximab? That is basically patient safety. Corticosteroid, we know about corticosteroid safety. Stress dose IV hydrocortisone in labor, that is steroid rescue. Okay. Applied clinical knowledge, demonstrate knowledge of current literature on the management of IBD. Explain the implication of Crohn's disease on the pregnancy and pregnancy on Crohn's disease. Discuss a discussion on medication. Okay. So basically, this discussion on medication was important here, which we need to. Okay.
Okay, ma'am.
Yeah. Overall good attempt. You know the present skill of you are having a skill of presenting also. Only thing is you are repeating most of the information what has been
Mm.
given there, and again you are not paying attention what I was saying. I have mentioned that I had cesarean section. You again asked how I was delivered. Okay, so those questions you need to pay attention to the role player. You acknowledge the information so that your information gathering timing was minimized. In your case, it was almost 7 minutes.
Okay, ma'am. Okay, I'll take care of that, ma'am.
Yeah.
I'll
Thank you.
practice that. Thank you, ma'am.
Ma'am, can we give aspirin, ma'am?